Have you been trying to conceive for months now or even years and it's not working out? And you're getting frustrated. You're trying to lose hope. Every test you have done seems to be perfect. You're seeing your ovulation, you're menstruating normal, everything seems perfect, but you cannot conceive. This singular test I'm about to expose to you now will help you determine if there will ever be fertilization. For fertilization to happen, the egg will have to come to the fallopian tube and wait for the sperm. And after sexual intercourse, the sperm will swim to the fallopian tube and fertilize the egg. Okay? That is how it happens. Now, the reason why you're not conceiving might just be that the sperm cannot meet the egg to fertilize it. You're ovulating. Every month you ovulate. You're seeing your period monthly. You don't have issues with that. But the sperm cannot fertilize the egg that is in your fallopian tube. Meaning that your fallopian tube is blocked, but you don't know. This test is going to help you to find out if your fallopian tube is blocked or not. Because without fertilization, there won't be formation of a baby. Now, there are so many things that can block your fallopian tube. One is infection. Untreated infection can block your fallopian tube. Bacteria can travel from your vagina to your cervix, to your uterus, and to your fallopian tube and cause scars. It will cause scarring of the tissues in the fallopian tube. And when there is scars in the fallopian tube, it will narrow the fallopian tube or block the fallopian tube totally. So, sperm can no longer swim to meet the egg and fertilize it. Another thing that can block the fallopian tube is previous surgeries and endometriosis. Yes, that's another thing that can block the fallopian tube. Or fibroid. There is a way the fibroid will position. It will block the fallopian tube. Remember, there are different types of fibroid. There's a position it will be. It will block the fallopian tube. Now, what is the name of this test? The name of this test is HSG. HSG. So, when you do this test, it's going to help you to determine if your fallopian tube is blocked. If your fallopian tube is blocked, you take the next step in meeting your doctors. Your doctors will know the best way they can help you. Instead of wasting your time, instead of wasting several months and years trying to conceive naturally, do this test today. Do HSG today. Now, there's a test for men. In a situation where your fallopian tube is not blocked, all the tests that you have run is okay, there's nothing wrong with you, then your husband should do semen analysis. It's going to help to determine the concentration of the semen, whether the semen concentration is okay or not. A normal concentration should be 15 million sperm per milliliter. Okay? The second one is the volume of the semen. Okay? The volume of the semen should be within 1.5 to 6 mils. Okay? Because the lesser the volume of the semen, the lesser the sperm inside that semen, okay? And if there is not enough sperm in the semen, there won't be enough sperm to swim to meet the egg for fertilization, okay? Another thing is the motility of this sperm, the movement of this sperm. 40% of this sperm should be active, okay, and moving forward. It should be able to be fast, so that it can swim and fertilize this egg, okay? Another thing is the shape of this sperm, the morphology. At least 4% of this sperm should have a normal shape, okay? Some sperm have 2 heads, 2 tails. No, those type of sperm cannot fertilize an egg, okay? 4% of this sperm should have a normal shape, okay? So that it can be able to fertilize an egg, okay? Another thing this test is going to determine is the pH level of this sperm, okay? Whether this sperm is too acidic or too alkaline, okay? So it's going to help to determine if fertilization can occur. I hope you learned a lot from this video. Don't forget to share this video to every TTC mom that you know, okay? You owe them this video. Share this video to them. We'll see you on our next video. Bye-bye.